If you're approaching a nursing assistant job interview, it's crucial to prepare thoroughly. This video will guide you through the top questions you might encounter, along with thoughtful and effective responses. 1. Why did you choose to become a certified nursing assistant? I chose to become a certified nursing assistant because of my passion for helping others. I believe that providing care for people in need is a noble and rewarding profession. I find immense satisfaction in making a positive difference in the lives of patients and their families. As a CNA, I have the opportunity to directly impact someone's quality of life. I also enjoy the challenges that come with the role, as they push me to continuously learn and grow in my skills. The healthcare field has always fascinated me, and being a CNA allows me to be a part of this vital industry. 2. What qualities do you possess that make you a good fit for this role? As a certified nursing assistant, I bring a combination of essential qualities that I believe make me fit for this role. I am compassionate and empathetic, which aids me to connect with patients and understand their feelings or discomforts. I am also patient, an essential trait when dealing with individuals in distress or those requiring assistance with daily activities. Having exceptional communication skills, I effectively convey information to patients, their families, and healthcare professionals. I'm also a good listener, ensuring that I understand the concerns and needs of my patients. I have strong attention to detail, which ensures that I accurately follow medical instructions and observe any changes in a patient's condition. My ability to work in a team enables me to collaborate effectively with other healthcare providers. Lastly, I am physically fit, which is necessary for the demands of the job. 3. How do you handle stressful situations in a healthcare setting? The key to handling stressful situations in a healthcare setting is maintaining composure, prioritizing tasks, and employing effective communication. In high-pressure moments, I remain calm and focused on the task at hand, ensuring safety and quality care for the patient. I prioritize tasks based on urgency and significance, which helps me manage my responsibilities efficiently. I also believe in the power of teamwork and communication. I never hesitate to seek assistance or advice from my colleagues when needed, and I ensure to keep them informed about any critical situations or changes in a patient's condition. This collaborative approach not only helps me deal with stress but also fosters overall teamwork and patient care. 4. What do you find most rewarding about being a CNA? In my view, the most rewarding aspect of being a CNA is the ability to make a tangible difference in someone's life on a daily basis. Assisting patients with their daily activities, health needs, and emotional support brings immense satisfaction. The gratitude expressed by patients and their families for the care provided is heartwarming. The personal connections built during the process are deeply fulfilling. I also value the opportunity to learn from each patient's unique experiences and perspectives. This role allows me to contribute positively to society while growing personally and professionally. 5. Where do you see yourself professionally in 5 years? In 5 years, I hope to have enhanced my skills as a nursing assistant, having had the opportunity to learn and grow in diverse healthcare settings. I see myself possibly advancing towards a more specialized role, maybe as a registered nurse or a nurse practitioner, depending on the educational opportunities I am able to pursue. I am also open to taking on leadership roles, such as a head CNA, if it fits with the needs of my workplace. I am committed to lifelong learning and aim to continuously improve my abilities to provide the best care possible for my patients. 6. What prior experience do you have working as a CNA or in healthcare? As a certified nursing assistant, I have gathered significant experience in the healthcare field over the years. I started my career working in a small community hospital where I gained comprehensive hands-on experience in basic patient care, monitoring vital signs, and providing support to nursing staff. Later, I moved on to a larger, more specialized hospital where I had the opportunity to work in different departments, such as the emergency room, geriatric ward, and surgical unit. This gave me a wider perspective on the variety of healthcare settings and patient needs. Through these experiences, I have developed strong communication skills, the ability to work in high-stress environments, and a deep understanding of patient care protocols. I believe that my background and experience make me a strong candidate for this role. 7. What are your strengths and weaknesses as a nursing assistant? As a nursing assistant, my primary strength lies in my ability to connect with patients on a personal level. I find that this allows me overall to provide better care and create a more comfortable environment for them. In addition, my communication skills help me to effectively convey information to doctors and nurses, ensuring that all members of the healthcare team are informed about a patient's status. On the other hand, one area where I could improve is in dealing with high-stress situations. While I am generally able overall to remain calm and collected, I sometimes find myself becoming overwhelmed when multiple patients require urgent care at once. However, I am committed to improving in this area and am actively seeking further training and education to help me better manage these situations. 8. How comfortable are you with performing basic patient care tasks like bathing and feeding? As a certified nursing assistant, I am fully comfortable with performing basic patient care tasks like bathing and feeding. These tasks are integral to the role and contribute significantly to improving a patient's quality of life. I understand that for some patients, these tasks can be a vulnerable and sometimes uncomfortable experience, so I always approach them with the utmost sensitivity, respect, and patience. I have received comprehensive training in these areas, allowing me to perform these duties efficiently while ensuring the patient's dignity and comfort are preserved. I believe that these tasks, while basic, are fundamental to providing quality care and promoting a positive healthcare experience for every patient I serve. 9. Describe your experience with taking and recording vital signs. In my previous role as a CNA, I routinely measured and recorded patients' vital signs. This included monitoring blood pressure, temperature, pulse, and respiration rates. I utilized digital and manual equipment to efficiently gather these data. I also have experience in recognizing abnormal readings and taking immediate action to alert the healthcare team. I ensured accuracy in the data collected and recorded it promptly in the patient's health record. I understand the importance of this task, as it aids in monitoring the patient's health status and informing their treatment plans. 10. How would you handle a situation where you're unsure how to complete a task? It's crucial to never pretend to understand a task if it is unclear. My first step would be to re-evaluate the task, try to break it down and understand what is required. If it still doesn't make sense, I would seek clarification from a supervisor or more experienced colleague to ensure safety and quality of care. I would take notes or ask for a demonstration if needed to ensure I fully comprehend the task. I believe asking questions is an essential part of learning and improving, and it shows my dedication to providing the best care to patients. It's always better to ask for help than to risk making a mistake that could affect a patient's health or well-being. 11. How do you ensure patient privacy and confidentiality? In healthcare settings, patient privacy and confidentiality is paramount. As a certified nursing assistant, I am committed to upholding these principles. I only access patient information when it is necessary for their care, and I make sure not to discuss patient details in public areas or with unauthorized individuals. I also ensure that any documentation containing patient information is securely stored and disposed of properly. For electronic records, I log out of systems when I am not using them to prevent unauthorized access. Additionally, I always respect the privacy of patients during personal care tasks, ensuring curtains or doors are closed and their dignity is maintained. 12. What would you do if a patient refused care or became combative? If a patient refused care or became combative, my first step would involve trying to understand their concerns. I would maintain calm and patient demeanor, using clear, simple language to communicate. I would also maintain a safe distance, ensuring the safety of both the patient and myself. Providing reassurance and empathy can help to diffuse the situation. If the patient still refuses care or continues to be combative, I would inform my supervisor or a nurse, keeping them updated about the situation. I believe in providing patient-centered care, which includes respecting their choices, even if they refuse care. However, I would never compromise on safety and would always follow the proper protocol for such situations. 13. How do you show compassion and empathy when caring for patients? Each patient I care for is not just an individual needing medical attention but is also a person with feelings, fears, and hopes. Showing empathy requires understanding their emotions and feelings. I strive to listen actively, validate their emotions, and offer comfort. It's vital to ensure they feel heard and cared for. Compassion, on the other hand, is expressed by showing kindness, patience, and warmth. It's about going beyond the call of duty to make them comfortable. This could be assisting them with personal tasks, comforting them during moments of distress, or simply taking the time to have a friendly chat. 14. Describe your approach to communicating with patients who have difficulty speaking. Understanding and effectively communicating with patients who have speech difficulties is a critical part of my role as a certified nursing assistant. My approach is to be patient and attentive, allowing them ample time to express themselves without feeling rushed or pressured. I use various communication aids, such as pen and paper, pictorial cards, or speech-generating devices, depending on the nature and extent of their speech impairment. I also use simple, clear language and confirm their understanding by asking them to repeat or demonstrate what they understood. It's always about respecting their communication style and adapting to their needs to ensure their comfort and understanding. 15. How would you respond if you noticed signs of abuse or neglect in a patient? As a certified nursing assistant, my main aim is to ensure the safety and well-being of patients. If I were to notice signs of abuse or neglect, I would promptly document the observations, making sure to record any visible signs of abuse and any changes in the patient's behavior. I would then report my findings directly to my supervisor, providing them with the documented evidence. It's essential to involve the appropriate authorities within the healthcare facility to ensure the issue is addressed promptly and effectively. It's crucial that all staff members adhere to the proper protocols when confronted with potential abuse or neglect in order to protect our patients. 16. How do you collaborate effectively with nurses and other healthcare staff? Working effectively with other healthcare staff requires clear communication, respect, and understanding of each team member's role. I believe in maintaining open lines of communication, whether it's discussing patient care or addressing issues as they arise. I value each team member's expertise and believe that everyone's contribution is critical in providing the best patient care. If there's a problem or misunderstanding, I prefer to address it directly and professionally, ensuring that it doesn't affect patient care. In my previous role, I found that regular team meetings were a great way to keep everyone informed and on the same page. These meetings allowed us to discuss patient updates, changes in their care plan, and any concerns or suggestions team members had. It fostered a sense of teamwork and collaboration, which I believe is crucial in a healthcare setting. These experiences have honed my ability to work well in a team and collaborate effectively with my colleagues. 17. Describe a time you had a conflict with a coworker and how you resolved it. In my previous role, I had an incident where a coworker and I had a disagreement over a patient's care. My coworker believed the patient required more rest, while I insisted that the patient needed to be encouraged to move to prevent bed sores. This led to tension between us, as we both believed our approach was correct. Recognizing the importance of collaboration in a healthcare setting, I suggested we consult with the patient's lead nurse. The nurse agreed with my assessment, but also recommended implementing periods of rest for the patient. This incident taught me the value of open communication and consultation with superiors when conflicts arise. 18. How do you prioritize tasks when caring for multiple patients? Being a certified nursing assistant requires efficiency and good organizational skills, especially when caring for multiple patients. My approach is to always prioritize according to the medical needs of the patients. Those with urgent or critical needs are attended to first. Following this, I focus on the routine activities that need to be carried out for all patients. These may include taking vital signs, ensuring medication is administered on time, and helping with personal care tasks. If certain tasks demand more time and attention, I communicate effectively with other healthcare staff for assistance. By organizing my tasks in this manner, I am able to provide quality care to all my patients without compromising on their individual needs. Honesty, patience, and good communication skills are also crucial in maintaining a smooth workflow in a healthcare setting. Of course, every day is different and bringing flexibility and an ability to adapt quickly to changing situations is key. 19. What would you do if you witnessed a coworker not following proper procedures? In the event of witnessing a coworker disregarding protocols, my first step would be to gently remind them of the correct procedure. It's possible they've made an honest mistake or forgotten a step, and a friendly reminder can be helpful. If they continue to ignore the guidelines, I would bring the issue to a supervisor's attention. It's crucial to prioritize patient safety and ensure that we're all adhering to standards to provide the best care possible. I believe in maintaining a supportive and constructive work environment, therefore, handling such situations with tact and professionalism is important. 20. How do you ensure clear communication during shift changes? Clear communication during shift changes is vital in order to ensure seamless patient care. My approach includes a comprehensive handover where I detail the patient's condition, any changes that occurred during my shift, tasks completed and pending, and any specific instructions or concerns from doctors or nurses. I ensure all pertinent information is passed on, avoiding medical jargon if the next shift is not medical personnel. I also encourage questions during this handover for clarity. In instances of critical care, I ensure that important information is relayed directly to the incoming personnel. This might include potential warning signs to watch for, or crucial medication timelines. I also take notes during the previous shift's handover to refer back to during the day. This helps me remember any important points that I need to pass on to the next shift. By doing this, I maintain transparency and ensure that everyone is on the same page, creating a smoother transition between shifts. 21. A patient has fallen. Walk me through the steps you would take. First and foremost, I would ensure my own safety before approaching the situation. Then, I would calmly approach the patient without rushing, to avoid causing additional harm or distress. I would assess the patient from where they are, checking for any visible injuries or pain. If the patient is responsive and does not seem to have any severe injuries, I would call for assistance to help lift the patient safely. If the patient is unconscious or severely injured, I would not attempt to move them. Instead, I would immediately call for medical assistance while ensuring the patient's head is protected. I would then stay with the patient, providing reassurances while waiting for medical help. Once the situation is under control, I would document the incident, including the time and location, any identified causes, the patient's condition, and the actions taken. This information is crucial for medical records and future preventive measures. 22. How would you calm an agitated patient with dementia? My approach to calming an agitated patient with dementia would be grounded in patience, empathy, and understanding. Firstly, I would use a soft tone to communicate, reassuring them that they are safe and cared for. I would attempt to distract them with familiar and soothing activities or items, such as listening to their favorite music. Additionally, I would ensure their environment is calm and comfortable, reducing any stimuli that may be causing distress. If necessary, I may seek assistance from other healthcare professionals for additional strategies. Remembering that every patient is unique, I would tailor my approach based on the patient's preferences and history. 23. What would you do if you noticed change in patient's condition? If I noticed a significant change in patient's condition, my first step would be to thoroughly document the changes observed. This includes any physical or cognitive changes, as well as any changes in behavior or mood. Then, I would immediately alert the nurse or doctor in charge, providing them with the documented details to ensure they have a full understanding of the situation. Depending on the severity of the changes, I may also initiate emergency protocols if necessary. It's crucial to act swiftly and appropriately in these situations, as prompt response can potentially prevent further health complications for the patient. Remember, preparation is key. By reviewing these questions and responses, you'll be well equipped to give confident, articulate answers that impress your interviewer. While each interview may vary, these questions provide a solid foundation to showcase your skills, passion, and readiness for the role. If this video was helpful, please give it a thumbs up and don't forget to subscribe to our channel for more informative content like this.